You don't know about that.
We are live. We are live, and it is May 1st. You always say rabbit, rabbit, the first day of the month, and it brings you good luck the rest of the month. But
we have asked on if you want to do this.
sure,
Yes, it's been all morning. I don't know where it's coming from.
is it let's try
It's
that.
out in the hallway.
Oh, it's
not.
It's been good.
Yeah, okay, all right.
okay. So it is May 1st, and this is Senate Health and Welfare, and we'll try and sort out what that beacon sound is. All right. So this morning we're taking up a number of bills in committee. First, I just want to say thank you for all the hard work that you're doing. This has not been an easy couple of weeks, and we have one more week of intense deliberations on our bills. So thank you for that. So let's move on then to H583. And we have, Jen, we've been through this with you. Let's hear from Jessica Farquist of Planned Parenthood. Jessica.
Hi.
And I'm just going to share with everyone, we're just listening. We're going to try and listen. We'll understand your concerns in the bill. We're not having a full discussion just because of the time in our lives.
Well, great. And I will be as fast as I can, I promise. Hello, everyone. Good to see you all. Jessica Barkwitz. I am the Vice President of Public Affairs for Planned Parenthood of Northern New England, and appreciate the opportunity to comment to you all on H583. Just to start, we wholeheartedly support the intent of this bill and the desire for more transparency across the board in our healthcare system. We especially support section 9772, that limitations on control of clinical decision-making, which ensures that clinical decision-making and treatment decisions are exclusively in the hands of healthcare providers. That is absolutely a great thing. We do have some concerns around some of the reporting requirements and how that will interact with our SHIELD laws that I want to touch on. So section 9773 is the reporting of ownership and control. It sounds like the attestation form is just going to be a signature. That sounds okay, but would love some clarity around the process for attestation, how often, notice of requirements, guidelines, all of that, just to make sure that that it feels manageable for our small businesses. And then when we get into the reporting of private equity and the confidentiality, I have some lingering questions around how it will interact with our SHIELD laws, and to quantify this, I guess I'll say that Planned Parenthood doesn't have any private equity. I don't know if there are any providers of legally protected healthcare that do. But that being said, I want to make sure that we don't conflict in the future. And so for those of you who weren't here, for our SHIELD laws really protect patients and providers who provide legally protected, reproductive, and gender-affirming healthcare. And these laws really restrict the ability of courts and state agencies to compel testimony or documents or to provide information when doing so could aid out-of-state investigations or litigations related to that legally protected healthcare. So these protections are not limited to doctors alone. They're really intended to protect that entire ecosystem that makes that care possible from being exposed to legal or financial retaliations. And so some of the reporting requirements in that language around like the name and business address, identification number of individuals or entities that have ownership investment, the detailed organizational chart, including affiliates and subsidiaries, and the profit loss balance sheets. Those, I think, we want to think really carefully about who accesses that information, why they need that information, and what they can do with it. Compelling ownership and investment disclosure could risk assisting out-of-state enforcement. Our SHIELD laws are really designed to prevent the flow of information that could be used by other states to target abortion or gender-affirming care. And so mandatory disclosure of ownership or investment information could create that ready-made roadmap that identifies who finances, governs, or supports these providers. And if it's held by an agency or some sort of process that could be obtained by hostile out-of-state actors to identify folks, that could put us in a really tricky position. Similarly, under our framework, our courts are prohibited from ordering testimony or documents in connection with those out-of-state actions targeting legally protected care. And these reporting requirements risk sidestepping those protections by requiring this advanced routine production of this sensitive governance and finance documents. So in other words, information that our current existing laws would not allow to be compelled in response to litigation could instead be pre-collected through regulation and the Green Mountain Care Board under this, which would undercut the practical effect of our SHIELD laws. And then finally, I'll just say that, our SHIELD laws recognize that this care, reproductive care, gender affirming care, it doesn't happen in isolation. And it often depends on management entities, affiliated organizations, donors, insurers, and investors. And so, again, I want to caution that we're really careful about our definitions and who gets this information, because requiring public disclosure of management service organizations, affiliates, investors could risk exposing individuals and entities who could face retaliation purely because of their association with this type of care. And I think about this particularly as we're getting into a really unknown space with gender affirming care and what the future of that care and how that care is financed could really look like in our state. And we want to make sure that we're doing what we need to do to protect clinical decision-making and care, which is so important in this bill, and also that we're not hampering any innovation in investment in care as we move forward. So that's kind of my word of caution. We did work with some of the other providers on a memo, and I know that the APRNs who are much more in the clinical space have some more of that information for you. But, I think ultimately what I'm trying to say is I think that we just have to have a little bit more clarity on what's reported publicly and how that confidentiality will be kept, and really weigh the benefits and risks of exposure of this information. So who needs it, how that comes to them, whether that's in an aggregate form or, as an individual, and whether or not there are clearly defined consequences or penalties related to any breaches of that confidentiality. So thank you all for your time and for your work on these really important topics.
Thank you very much. And we have your testimony really are in the form of recommendations for different sections of the bill.
Yeah, we sent a memo with some other groups. Yeah.
Okay. With others.
Hi, I think that's me. Can you hear me?
Okay, good. Thank you. So with the Nurse Practitioners Association and others. So, right. So any questions of clarification for Jessica? So we can then move to Bridget. Thank you for being here. I understand that you're taking Michelle's place. She got called to the hospital. So thank you for being here.
Yeah, thank you for allowing me to step in for her. I'd like to take an opportunity to introduce myself. My name is Bridget Meehan Brees. I'm a doctorally prepared nurse practitioner. I work for Gifford Medical Center. I also serve on the Vermont Nurse Practitioners Association board. And as you mentioned, my colleague Michelle was pulled into the hospital this morning, and she asked me to take over for her. So bear with me while I give you some comments, if that's all right. So I'd like to talk a little bit about some of our concerns and recommendations for H583 moving forward. Under the current legislation, every healthcare entity must either file an attestation or report with the Green Mountain Care Board, depending on whether or not their ownership includes or does not include a hedge fund or private equity group. Given the significant penalties that would apply if the wrong form is filed, it's imperative that the definitions are really crystal clear. In addition, we would like to ensure that the definitions of hedge fund and private equity group would not encompass groups of individuals in the community who could come together to support a healthcare entity such as a startup birthing center. As currently drafted, it's unclear if the definitions would apply to those types of grassroots investors. Um, Also, in terms of transparency, we're really very supportive of transparency in general. Some financial and identifying information can be really sensitive. This bill does allow for sharing of information with state officials not defined who do agree to maintain confidentiality. However, there are currently no provisions in the bill ensuring that confidentiality and what the penalties are for breach of confidentiality. Given the politicalization of healthcare and its data and concerns particularly related to the provision of legally protected healthcare, this blanket allowance is cause for concern. Who has access to this sensitive information should be considered and clearly be defined within the scope of the bill language so that we don't put our healthcare providers at risk. We have some recommendations for amendments to this bill that might make it more effective, and that might make it a little bit more friendly for healthcare providers that currently practice in the state. I think the first thing that we would recommend is clarify the definition of hedge fund and private equity group so that they're crystal clear and that there's no subject for interpretation. In terms of reporting and attestation, perhaps remove the reporting requirement entirely. Nowhere else in the space of healthcare right now do you have to submit this type of attestation or reporting. If the reporting isn't removed, perhaps require the Green Mountain Care Board to develop a form or process for filing. Additionally, require the Green Mountain Care Board to provide notice as well as details to be included in the attestation. And lastly, require the Green Mountain Care Board to provide guidance on healthcare entities as to how to determine whether or not they need to file attestation or reporting. The fact that I'm here today demonstrates how important patient care is to healthcare providers in Vermont. Michelle can't be here because she's taking care of patients today. And putting an onerous reporting burden on healthcare providers that isn't clearly defined would take away from patient care, which is not anybody's goal. In terms of confidentiality, we would recommend that we set forth a breach of confidentiality penalties for the Green Mountain Care Board, Office of the Healthcare Advocate, and public officials. Additionally, require the Green Mountain Care Board to provide this information to the healthcare advocate in aggregate, removing any and all identifying information. Lastly, or not lastly, but additionally, we think maybe having some possible exemptions in place in the bill language would be helpful, perhaps exempting independent practices or considering practice size when applying exemptions. And as we said, transparency is really important. Limit who has access to the information that's being reported in the bill language, just so that we can protect data appropriately. Again, I want to thank you so much for your consideration and for hearing our concerns today. And I want to thank you for allowing me to step in last minute for my colleague.
Okay, thank you. So your testimony is in the form of the letter that we received along with Planned Parenthood?
Yes, it is in the joint memo that you received.
All right, that's great. And then you're talking about the form to be developed by the Green Mountain Care Board. And are you thinking then that this form would be available to the to the healthcare advocate upon request, or is that?
So I think that in a couple of ways, yes, having a clear process for the form, having a clear process that's laid out by the Green Mountain Care Board as to who needs to attest and when they need to attest and what forms they need to access, and then making sure that access to the data is clearly defined and that healthcare data is being protected in the language of the bill.
Okay. I think there's a huge concern about healthcare data, individual healthcare data, and the question here is regarding hedge funds and equity investments.
Yeah, absolutely. And, I think that the group that I'm working with appreciates that this is a bill that's really designed to protect Vermonters against hedge funds and sort of bad actors. But we want to make sure that we don't limit our really good healthcare providers in the state and require onerous burdens or onerous reporting burdens.
Okay, yeah, no, thank you. So what I'm hearing you say is that not all investments are bad. Some are
Yes.
good.
Yeah,
Okay.
absolutely. Like a grassroots investment would be fantastic, right? For a small birthing center. That would be a wonderful thing to have.
Any questions for Bridget? Thank you, and thank you for the very succinct recommendations on the bill.
I
Appreciate
tried
that
my best. Thank you.
a lot. All right. Okay, so we'll move on to Helen Laban, Vermont Healthcare Association.
Yes, thank you.
Thank you for being here.
Thank you. I'm Helen Laban, Executive Director of the Vermont Healthcare Association. We represent nursing homes, assisted living residences, and residential care homes. This bill primarily affects the nursing home part of that equation. And first, I'll say that we are very supportive of the corporate practice medicine section of this bill. Probably lots of people will say that. I will save time by not going into detail about why we support that. For the rest of the bill, we are generally neutral. I think that the example of nursing homes might be a good example of a sector where we've seen a lot of regulatory activity recently around these issues of ownership, investment, and private equity in particular. One thing to know about nursing home policy is that there's always a tension between what's said at the federal government level and what's said at the state level. So often when we talk about quality regulations and the day-to-day operations, there's very extensive federal regulation of what we can and cannot do. When it comes to issues of approving ownership, transparency in ownership, whether or not you have a certificate of need, what sort of cost data Medicaid agencies have eyes on, that varies widely from state to state. It goes from, I would say, bare minimum, bordering on non-existent, through to where Vermont is, which is one of the most robust systems we have in the country. And that system has seen recent updates over the last 2 years, largely in response to concern over things like private equity and other ownership practices. So in Vermont, we have across different divisions, we have, of course, the certificate of need process at the Green Mountain Care Board. We have transfer of ownership, very, very extensive disclosures before you can be approved for transfer of ownership over a DALE. We also have material change disclosures that are required. Additionally, we provide full audited cost reports to the Division of Rate Setting. The Division of Rate Setting also reviews those for any areas of concern, such as expensive management fees, concerning property deals. Those are reviewed at the Division of Rate Setting. These happen every, well, depending on whether you have a change of ownership, but the cost reporting is every year. On top of that, there have been changes at the federal level for disclosure of ownership and ownership transparency. Those are for both who has a management interest in the facility as well as a 5% share and additional items beyond that. Those have been implemented starting in 2024 at the federal level. Those are publicly available in databases. We also have public disclosure of our payroll accounting that's also available in a public database. And I'm happy to provide all of the links and connections to these different pieces of information, which are available for review for the public generally, and also could be accessed by someone like the Green Mountain Care Board if they wanted to do a report. Hence, you will also see that because our current reporting requirements are beyond what's contemplated in 583 and also available to a reviewer such as the Green Mountain Care Board, the nursing home exemption from these additional or duplicative parallel, whatever the word would be, reporting requirements of 583 because that information is available. I do want to caveat what I'm saying. I'm happy, again, to provide you all the details that you want. I don't want that to be taken as dismissive of other providers' concerns about the burden of this reporting. I want to be very clear that this has been a high intensity effort over many years, some of which has been in place well before now, some of which is recent to the last couple of years. this was not a simple looking at the light switch and suddenly we had all this data. So even though I'm happy to give details on what is reported now in the nursing home sector, again, just because it's in place now doesn't mean it was easy to get here. So I very much don't want to be implying that my colleagues don't have reason to have concerns or be asking questions. This is just how it is for our sector right now.
Okay, questions? We don't have any testimony from you, but it's pretty clear. If you could send just an outline of some of the reporting requirements that nursing homes are subject to, that would be helpful. And I know we've been through some of this in this room as a result of some nefarious action in the past and tried to sort that out at the state level. So,
Well behind us.
yeah, well behind us. Thank goodness. Yeah. But thank you.
Thank you so much.
Okay, good. Maybe you should just. All right. Emily Brown,
Yes.
surprise, Madam Care Board
Morning.
here. Thanks for being here.
Yes, of course. Thanks for having me. Emily Brown, the Executive Director at
Do we have anything on, we don't have any, your testimony?
I don't have it, but I'd be happy to
That's just an
provide
outline.
a
is
summary and
helpful.
outline. I think generally supportive of the bill. We in this bill are called out as the entity that will be receiving all the reporting. I think we understand and appreciate and support the transparency effort here. I think that is a good thing and a positive thing. I think from the board's perspective at this time, I think we have a timing concern. So I think the bill calls for the reporting to begin July 1 of 2026. That is too soon for us to set up a reporting structure for this type of information. Right now, the Green Mountain Care Board, while we regulate hospital budgets, we do not receive any information of this type, this kind of business entity type of information from the hospitals or any other health entity in the state. So that would require us to essentially build a system to receive this information. I would not want to get into this and have a manual process for this information to come in to us. So we also have a resource concern because we don't know how many entities we're talking about. We don't know, as far as enforcement, we don't even know how we would enforce this because again, we don't know who these entities are. I would like to say there on the last page of the bill in subsection C, there's this acknowledgement that the board shall work with other state entities to avoid duplication or information that's already submitted. I think what the board would prefer is if we could do this exercise of exploring if this information is already coming in different forms, who is the information going to, whether it's the federal government or at the state level, and try to work with the Secretary of State, the healthcare advocate, potentially AHS because they are a payer, and see what information is existing out there and actually design, kind of be more thoughtful about designing the reporting requirements around information and see what we can collect that's already there. And then if we need to kind of, have a reporting requirement that's in a different, we can do that. I think we would just like the time to do that exercise to figure out what's already out there and existing, and then work on setting up the reporting and the attestation. So it's essentially just giving us time to explore reporting options, figure out, if there's maybe another state entity that is better suited to collect this information or already has a system built that we could then take that information and post it on our website. I think the board is definitely supportive of the transparency aspect, as I said, of putting this on our website as the bill prescribes, but just generally has resource concerns and timing concerns at how the reporting is structured.
Do you have specific recommendations about that? It would be helpful for us to hear that.
Yeah, I at this point in time don't have like a timing, or recommendation on what that looks like. I think it would just be essentially like an opportunity to work with stakeholders to develop a reporting requirement And then there would be a date certain. I don't have a recommendation on what that timeline would look like. I, have to come back with that.
So we have a timeline.
Yes,
Yeah,
I
so,
understand that.
yeah, and I know everyone is just right under the gun right now. So please share with us whatever you can at this point. That would be helpful. I get it. Understood. There's information out there. We don't want to reinvent the wheel, and we don't want to cause extra administrative burden on any of our practitioners. This is, and so your comments, I think, are well taken. Or if you could send us something,
Sure.
that would be
Yep.
very helpful.
Of course, yep. No problem. Okay.
And you copy Jen.
Sure. Yeah. All right, thank you.
Okay. All right, so we have Mike Fisher
And
and Sam Peisch.
we're gonna have
Good team effort.
Sam's the guy.
Okay, all right. Yeah, okay. Great, thanks for being here.
Thank you for having me. Sam Peisch at the Office of the Healthcare Advocate. I'm a health policy analyst, not Mike Fisher. Thanks for having me and Mike. So just for the record, so there are a couple things that we heard this morning that I want to add to our written testimony, so I will submit that to be clear. So it's really important to have this on the record. I just want to give a bit of background. So this bill we've really been working on with a lot of stakeholders for around 2 years. So an earlier iteration of this bill was H71, which was a much broader bill, had a lot of process and transparency requirements with the board. It's also sponsored by Chair Black and Dr. Flimley. And then, so that was introduced in the last session. And then we really pared a lot of it back. We got a lot of feedback that the reporting requirements are too onerous. And we really took that back in stock, and what do we really need? What kind of information do we really need here? So I think this committee has received some testimony about the issue of private equity in healthcare, and some of the potential risks and downsides and impacts. So that's really what our interest is. And obviously our office is concerned with, we represent the public interest. We care about affordability and access. And we also, we try to keep our pulse on the ground about what's impacting patients. And folks are probably aware that there are some really unfortunate actions that private equity firms have taken in states around us. Folks are probably most familiar with Steward Healthcare in Massachusetts, where a private equity firm came in, bought a bunch of hospitals, closed them, bankrupted them, and then left with a lot of private profit. So that really, I think for a lot of folks, that put it on a lot of state lawmakers' radars. And I know the National Conference of State Legislatures, I believe Chair Black testified that this was the top issue that was discussed. So we really try to be responsive to those issues. So private equity firms, and if you look at the academic literature, the objective third-party literature, they are, there is pretty clear association with private equity ownership and control of practices and increased risk of negative patient health outcomes, higher costs, and really provider burnout and moral injury. What do I mean by moral injury? It's a doctor or a nurse who's being told to do something that they know is not in the best interest of a patient because there's a business interest at stake here. So that really gets into what's called the corporate practice of medicine doctrine, which is really at the heart of this bill. So what is that? That sounds like a very fancy, complicated name. So a prohibition on the corporate practice of medicine, what that really means in plain language is doctors should be independent. They should be given the autonomy to make clinical decisions for patients. And if you ask providers, this is a long-standing ethic within the medical profession. I come from a long line of providers in my own family. My grandfather was a pediatrician up in Burlington for many years, Jerry Lucy. My mom was a labor and delivery nurse. My grandma was a nurse. This is a long-standing ethic within the community. So it's in that vein. So there are at least 33 states that have a doctrine on the books in state statute. This is something that the American Medical Association has felt very strongly about for many years. We do not have one in the state of Vermont, which is kind of an odd feature, or I should say a meaningful one. So that feels like a problem, and I think that is a problem. There's a real consensus amongst the many stakeholders that weighed in on this bill and House Healthcare that we need one in Vermont. And so this bill, the current version of the bill, borrows language from adopted law in California and Oregon. So it's not like we're going rogue here. There's a long-standing precedent for this type of doctrine to be enshrined in state law. The other piece, we heard a little bit about reporting here. There is no real concrete database for private equity's impact on the healthcare system in Vermont. And I think I spend a lot of time in the State House. I spend a lot of time talking to patients and providers. There are all these whispers of like, where is private equity? What's the impact? Is it here already? And to really have a sense of what that looks like, we need data. And I know this committee rightly cares a lot about transparency. Now, threading the needle in terms of there is too much administrative burden in our healthcare system. Like, you're not going to hear me defending, getting unnecessary reporting and data, because out of self-interest, I don't want to look through data that doesn't have any value. Part of our role is analyzing a lot of this data. So we really tried to thread the needle. We pared back a lot of the reporting to really focus on what's most essential. And for us, that's who's controlling the medical practice, who's controlling the hospital, because it's important to us and important to patients and providers to know who's calling the shots with medical care. Patients and providers should know when they go into a hospital or go into a clinic that they can trust that their provider is just looking at their condition, looking at their tests, and being able to treat them as they see fit without fear of a business interest saying like, oh, you should push this medication, etc. So that's what this is all about. And that's the crux of what this bill is trying to accomplish. So what would this bill do if it was passed? So it would protect provider independence on autonomy, which I don't want to belabor that point. It would require healthcare entities. There are some exemptions, which we talked about. It would require them to report whether or not they're owned by a private equity firm or a hedge fund. And it would provide transparency on an issue that is of great interest, I think, to a number of legislators. And I should also say this is a bipartisan area of focus. So this bill passed out of House Healthcare, and it was a bipartisan passage. The bills that have been adopted in many states around the country, both on corporate practice of medicine or private equity, it's not like they're only being passed in blue or purple or red. They're being passed in red states too. Indiana was one of the first states to look at private equity regulation because there was fear about this encroachment of business interest on practicing medicine. So if you look around us, the neighboring states, almost every state has either just passed or is about to pass a similar bill to this. So Massachusetts, after the Steward healthcare, I'll say, disaster, they passed a pretty strong bill creating a regulatory and transparency process. Maine just passed the bill regulating this area. Connecticut's about to. New York is most likely going to. Same thing with Connecticut, New Hampshire. Like I said, Oregon and California were kind of leaders in this. I want to respond a little bit. Part of the reason I didn't submit this testimony is I wanted to be able to respond to some of the concerns that we heard this morning.
So what I'm going to say is
Yeah.
we're getting close to your time.
Yep, okay,
Just take one more minute
you got it.
and then we'll get your testimony in writing.
Okay. Yeah, so I mean, if there are ways to make, this is the first time I've heard a real concern about shield laws. We support shield laws 100%. I mean, this bill is really about financial information, not about patient information. I should say we are also we're a law firm. We work in legal aid. We handle confidential information all the time, financial information all the time. It's not new to us. We respect those provisions. We think they're quite strong. State agencies are also very accustomed to that. And we're also receptive to streamlining the process. That's why we had that language in there that authorizes the board to work with other agencies, like we don't want to reinvent the wheel. That's why we put that in there to empower them to be able to streamline it. So I just want to say this bill is incredibly important. And yeah, go ahead. Yeah.
Thank you.
Yeah.
You don't have to sell me on what this bill's doing. I'm very excited about it. I did want to ask if there's a way, if possible, to tighten up those two definitions, hedge fund and private equity, or do you feel that those are as tight as they could be in terms of definitions?
I think they're quite tight. They're pretty well established. They also come from existing law in California. The example, we don't want to sweep in grassroots investors. I think in my interpretation, and this is shared by many other people, it does not sweep in like grassroots investors in this way. Of course, I don't want to let perfection be the enemy of the good. You can tinker around the edges. But I think it's quite tight. I think if you read it plainly, it's clearly not intended to include investment. This is really about maintaining control of clinical decision making for providers. So,
Our rules for hospitals gonna say they're 501(c)(3)s.
Correct. Yep.
And if one of them were to sell to, say, a hedge fund, is there a public process for that?
There is Conversions Act statute that would go through the board. It would be very hard for a hospital, I think, to sell. I haven't heard any hospital wanting to do that. I think there's a question about private equity taking more control over certain service lines. I know this committee has taken some testimony about that. Where we see private equity,
You mean like a nursing?
yeah, like a nursing unit or something like that.
Radiology.
Contracting out to a-
Right, services.
Yeah.
Okay, so that's your main crux.
That is part of it. There's also, independent practices, private practices that are being owned by private equity firms. So we don't have any real visibility about what the scope and scale of that is at present. I think we know a bit about the nursing home field. To me, I think it's almost become like a trope. There is an affordability and access crisis. So to me, if we know, and I think it's fair to say that we know that private equity ownership, okay, go ahead.
So what I'm gonna say is, it's a lot of good information, and we would like it in writing, because we don't have the luxury of time right now. And
Yeah.
really appreciate the time you've taken to, inform us about the bill.
Yeah.
And how it will improve outcomes in our state. I do understand that, one of the concerns we would have about private equity investment in healthcare is, does it improve healthcare outcomes? And so that, I know there's data about that. We understand that. So it would be helpful to have your written testimony
Yeah.
into us. And I appreciate your time very much.
Sure.
Is there anything else that we absolutely need to know about this bill and the way it's drafted before you
Madam Chair.
provide that information?
Can I
Sure.
jump in, Mike Fisher? Can I just say, yes, we will work with the board today to look at the timing and try and figure out the path forward that works.
That would be helpful. And then the usual comment that I have is all the stakeholders at some point are going to be affected by this. So we'll have to see what comes out.
Yeah.
Okay. Thank you. Appreciate,
Thank you.
appreciate your understanding and your
Yeah.
patience and your time.
No problem.
It's good. Great. All right. So committee will wait to see that information that comes back from Green Mountain Care Board, Healthcare Advocate, and perhaps others, about how to make this reporting timely and not be overly burdensome. And then how access might be granted to that data. I'm not interested, frankly, in having it go everywhere all at once, but to have it consolidated in one place and then upon request. So that's what I'm thinking about. And all due respect to everyone else in the room, that the more we spread information out, the more it gets spread places we're not interested. So let's think about that one as well. We'll all think about that one. Oh, okay. So Jen, I'm gonna have you come up briefly and look at the bill. And then after that, we have 15 minutes. Thank goodness. We built this into our budget because we have H611 to look at as well.
Yes, I'm frantically finishing the amendment.
You're
To
finishing that up.
H611, just so
Okay,
you're
well then take your
aware.
time. And
What are we gonna, we're gonna look at 583 again and mark it out. Is that what we're doing?
we are, as soon as we have
Okay.
village council who can do that. She's finishing something, of course.
Right.
So we're gonna take a 2-minute break.
Great.